And we're live recording first of a kind news podcast. And I believe we assembled the most qualified crew to talk about whatever is going on in a dental space.
That is highly unlikely.
Agreed.
Yeah, why not?
At least it should be fun.
Let's give it a shot. If for whatever reason this not fun, at least for us, then we can always stop doing it. But I feel like dentistry is fun, and when you start talking about it from all these different angles, I think we start uncovering things that people are excited to hear. So we'll find out. At least I'm excited. I want to talk to you guys, and we got to go through some of the news that happened in the dental space and give it our best opinion. I just want to warn people ahead of time. These are our opinions, not related to any of our businesses and what we do. So whatever I say on this thing or any of us say on this thing does not reflect on our actual businesses. So don't hold us accountable. Don't listen to us. And if God forbid Brian gives the financial advice,
Run away.
run. Yeah. Yeah. So should we start?
Get it.
Let's go.
Let's go. All right. The first on the dock. Let's see. I want to share my screen and go right into it. We have a little spreadsheet that we've put together. All right. So dentists somewhat confident in economic recovery of dentistry. So we want to talk about this subject for a little bit. So what's interesting, the headline is a little shocking because I feel like dentistry is as stable as it gets. But they talk about more than 40% of dentists indicated that they were somewhat confident in the economic recovery of their dental practices and the dental care sector as a whole, according to a recent poll by the American Dental Association Health Policy Institute. The poll was taken as part of the ADA Monthly Economic Outlook, and here's what they say. Here's how confident dentists are in the economic recovery of their dental practices, the dental care sector in the U.S. economy. Their dental practice, very confident, 24.6%.
Real quick, is the assumption that they're talking post-COVID?
I believe so.
Okay.
Like, seems like recovery post-COVID. Somewhat confident, 40.3%, which is a high number. Neither confident nor skeptical. These are probably the dental town people, 17.9%. Somewhat skeptical, 13.8%. Very skeptical, 3.4%. I don't know the difference in their dental practice and dental sector of the U.S. economy. So whatever. I think the point is we have, according to ADA, somewhat confident, 40.3% of people asked that they're somewhat confident. I wonder what's your take on it, Aaron? Let's start with you.
So, well, the two different things, their dental practice versus the dental care sector, it's like their individual practice. This is how I feel about my practice. How I think we are doing as an industry, I think, is the dental care sector is what I think that's what I'm reading as those two differences. For me, I find this really interesting because I've been practicing since '88. I've been through a couple of cycles. I actually sold my practice in November of 2020. So we were shut down by the state of Maryland from March, the tail end of March. So April, May, June, and then we reopened in July. And month over month, 2020, for the months we were open versus 2019, we are actually doing better. I sold my practice in 2020. We did better in 2021, did better in 2022. So my question is, where's the downturn? And is what's going on with me the odd man out because my practice sat between Baltimore, Washington, D.C., and that area tends to be a little bit more stable economically. So we didn't really see a big downturn except when the state basically shut us down. But other than that, things have been pretty good month over month, year over year.
And where would you think, if that's the concern from people that they're not confident, I mean, it's a pretty high number. I would be curious to see what their poll size is. Where is it the entire U.S. or they just pick one state? I have to dig a little bit deeper into this. But I'm just curious if you would guess, why would people be not confident?
The only thing I can think of is why people wouldn't be confident is if in their particular practice they're having issues. Other than that, and to me, the bigger issues would probably be more to do with staff and staffing, hygienists, assistants, because that has become exponentially harder since the pandemic. So I don't know how much of this, that might be a good question too, how much of this is based on the economy and are people coming out and spending money, et cetera, and how much of this would be based on staffing and those kinds of issues post-pandemic.
Interesting. Ashley, you work with a lot of people, not just Aaron sample sizes, Maryland and East Coast, and a bunch of DC people, policymakers. What's your take on this news?
I mean, I think what Aaron mentioned before, dentistry is always a relatively stable, you know, uh, area of business if you're in it, and so I think that people are just realizing that after, post COVID, like Aaron just said, it was increasing. So they're somewhat confident now that it's going to continue to increase. However, there are all these talks, right, of another recession. But that, teeth always need to be fixed. People are all, it's a form of healthcare. So there is, even at some level, even if it is just emergency care or maintenance, versus the larger amounts that people are spending on maybe huge cosmetic cases or implants, but those are increasing across kind of the board as well. And people taking on debt even to get those types of cases. I think I'm seeing the same thing as Aaron is, even in his sample size across all of the dentists that I work with.
Interesting. Brian, so it seems like they surveyed 1,049 dentists. They could have just interviewed you as well, and that would have been a nice 1,050 people. But they missed, they missed out. It's a huge opportunity for them, and they didn't. So I'll take a chance and I'll ask you, like, you're a very optimistic guy with a bunch of offices in Texas. How did that affect you? And are you looking in the next 6 months skeptical or somewhat confident, or what's your take on this?
Yeah, let me tell you real quick why Aaron and Ashley are totally wrong. No, I'm just kidding. No, I think
that would be amazing.
Ashley's been waiting. One day she's going to be wrong. I don't know when it's going to be, but someday it's going to happen.
Stay tuned for further episodes, folks.
Right. I agree with everything they're saying. I think, there's a lot of stuff that happened in post-pandemic world, assuming this is kind of post-pandemic in nature. I think a lot of people were forced to look at their offices a little more. And so a lot of people are just kind of cruising, right? And then all of a sudden they had no paycheck, they had no patience. There's a big freak out. They start paying a little bit more attention to what's going on. And then they start to see, because there's always people out there with all of the negative stuff, right? Delta Dental just dropped, their fee schedules a bit. It's hard to get staff. And so there's some negative things that people are seeing. And so I think it just lends to skepticism. But it's interesting to look at. It's like a microcosm of society. Their personal dental practice, almost twice as much as how they feel about the dental care sector. So they're like, well, I'm obviously better, but this industry's going down. But it's interesting. It's interesting data.
And
is
then
the
compare
specialist
that to
versus go ahead, Aaron.
I was going to say, and then compare that to the U.S. economy in general, because look at the bottom two categories, and for their individual practice, it's about 17%. For the sector, it's about 21%. For the economy, though, it's 56%. So they're much more negative about the overall economy than they are about their dental practice or the dental sector in general.
Yeah.
So what does it say, Aaron?
It says to me that, I feel like I would imagine that folks are like, I feel like we're doing okay and we're all right, but man, I don't know what's going to happen in the economy. It could really be bad.
I think we lost you. Just can you repeat that?
I said I think what they're looking at it saying, like, my practice is doing okay, and the industry in general, because they know all those things about, it tends to be a very stable part of the economy, but the overall U.S. economy, I don't know if this is going to be good or not, because things just don't seem like they get lots and lots of bad news about the overall economy.
Interesting. A good number crunch on Brian's end. I didn't put two and two together that if you look at their dental practice versus the dental sector, that the numbers are almost like drastically different. Is it because it's easier to control when you look at your own dental practice and it's harder to control what things outside of your control? Like, are people being that pragmatic, or why do you think these numbers are that drastically different?
Doom and gloom, baby.
Brian, if you don't mind.
Doom and gloom. You're always gonna feel better about your own stuff, right? So you're making your payments and you're doing okay, but then you look at all of the things that you hear, which tend to be more negative than positive, and so what you hear from the dental care sector. I don't know how many text messages I got from people who had their kind of renegotiation from the beginning of this year until now with certain insurances, and their fees dropped, and they're like, this whole industry's going to crap. Well, figure it out.
Yeah, or it's a little bit like, when they survey people and they say, are you a better than average driver or not better than average driver? And like 80% of people think they're a better than average driver. Well, that's not possible. So I think maybe dentists are like, I'm a better than average dentist. I'm a better than average business owner, and so maybe they're a little bit more confident because of those sorts of things.
I was actually going to say that exact same thing. When you're asked to look at yourself, you're like, well, I'm better than that, but everything else, so that's a little bit worse. I don't know about them out there, but I know how I am here.
Mm-hmm. That makes sense.
Well, and just not to stick for too long on the subject, but do you think dentists are a little bit blindfolded here heading into the possible recession?
Blindfolded in what way?
In a way that, just what we described before, what Ashley said, that, hey, that's not me. I'm better than 80% or 20%. But would that be, would that in some way not prepare people correctly for the recession? And we can talk about it separately on how to prepare for the one if we're heading that way.
I wouldn't say dentists are going to be any different than any other sector. Look at what happened in the old COVID times. I think everyone from every single sector got caught with their pants down. They were like, wait, I was supposed to have 3 months of savings saved up? A dentist and everyone else. So I wouldn't necessarily say I think it's everyone. My opinion.
Cool. Anything else to add on the subject, on this optimistic subject?
Not for me.
All right.
Why didn't they ask hygienists how they feel?
That actually be a really interesting question, because I think less hygienists came back to work than any other part of the dental team.
Speaking of dental teams, there's this interesting headline that says 10 states where dentists may see success retaining staff. I thought it depends on a dentist, but actually you can outsource that on a state and find the right state where to open an office. But basically they say dentists in Massachusetts could see success. I don't understand this because it's super cold there, but see success retraining staff as the state has the lowest job resignation rate in the USA, according to the personal finance website Wallet Hub. In the report released on March 21st, Wallet Hub ranked the states and Washington, D.C., near Aaron, from highest to lowest job resignation rate. The website analyzed each state job resignation rate for the last 12 months, and here's the 10 states. Number 1, Massachusetts. Number 2, New York. Number 3, New Jersey. Number 4, District of Columbia. Number 5, Pennsylvania. Number 6, Connecticut. 7, California. Number 8 is Maine. Number 9, Virginia. Number 10 is Wisconsin. What is your reaction to this, Brian? Not to see Texas on this list.
Well, I still have ties to New York, so I'm going to call it bullshit. The problem that we're going to see with a lot of this stuff is, the way that they gather statistics, and I think we're going to see this on a lot of articles, and so I don't know the lowest job resignation rates. How exactly do we pull that? I look at this. I really, it is interesting. I always find these things interesting when they're comparing, state by state. I bet if we looked at this, the difference is single percentage points, which isn't statistically significant anyway. But really, what it makes me think is like the states that I have business in are not on here. So if I live in a state, and really, if I have a business in any state, I should just be paying attention to my team so that they don't resign. That's all I'm thinking about. How do you be a better business, a better boss, so that you don't lose your people? I don't know if the states matter much to me.
They actually have the. Sorry to interrupt you, Tiger.
Yeah. No, go.
Yeah, they actually have the statistics here, and you're absolutely right. So in between the highest and the lowest is like, out of the 50 states is with 1.5%. Yeah, 1.4% is the difference. in highest and lowest resignation rate. But you hit the nail on the head. It's just, pay attention to your team. I think that in this world, it's gotten to be, very much a matter of, people are not working. This generation is not working as hard as the last one, to be totally honest. They just don't want to. They're like, I would rather not have children and have a house for my dog than have than have this certain type of lifestyle. So paying attention to what are the priorities of your team and dedicating yourself to not being a boss hole, I think, is the
what
key
this is
to
making me
education.
want to do is like, you guys saw Beautiful Mind, you know, like when he
Oh yeah.
starts putting all, and there's like pieces of yarn and like data points everywhere. And I'm like, could we put every single one of these surveys onto some huge whiteboard and make connections and determine that like Northeast Delaware is actually the most ideal place to like live, practice, have a business? I feel like we could put it all together with all of this stuff.
I like that.
I don't know. Aaron, you're the one who has the most experience on this call. Looking at this, what does it make you think?
A, I feel like you're calling me old. Secondly,
I love you.
So I also got on Wallet Hub and started reading through this a little bit to see what they have. First off, this isn't confined to like dental staff. So this is just employees in general. And then they're looking at the resignation rate over the last 12 months, and it ranges from 1.8 to 4 point something percent. And the truth of the matter is that business owners are just like everybody else in the world. Some are good, some are bad, and if what you're counting on is the fact that your team can't get a job somewhere else to keep them in your office, that's pretty pathetic. It's like, why don't we be a little proactive? Why don't we go out there and learn how to be good bosses, how to make their lives better, that makes our life better, that helps your patients, like let's do the virtuous cycle. Let's not plan on just not falling to the bottom of the pile, to keep our staff members in place. We all know that there are, man, for years there was an office up the road from me where the doc just was not nice to his staff, and he would just bleed staff constantly all the time, and we all knew it. And it was really simple. There were certain things that would happen on a regular basis. A former staff member would come in, interview, and say, yeah, the last one, this happened. We're like, oh, it's Dr. So-and-so's office. Yes, it was, because he was terrible, And so you don't want to be that guy. You want to be the guy where it's like, we can never get those people away from that doc, and they are so good because they've been there so long, and he trains them so well, and he treats them so well. That's the guy you want to be, not the average from their survey, across the United States.
Yeah, it feels like they pretty much outsourced. It seems like you're outsourcing your responsibility to retaining the staff to the state. That's how the title came across to me when I read it first. But I'm curious, like Aaron, you pointed out that you don't want to be that guy. I think it's really hard sometimes to realize that you're that guy. So like if I'm driving right now in the car and I'm that guy, how do I know that I'm that guy?
Okay, so this actually happened to me. So in my first 2 years of practice, I bled staff like nobody's business. Okay. And I thought I was a pretty nice guy, like I had friends and I had family and I wasn't raised by wolves, and so I figured I was okay. Every time I went on vacation, I lost 2 staff members because they had a week off to go interview other places, and then they were gone. And it happened over and over. At one point, I literally sat in a chair and said to myself, it's been 2 years. I've turned over 2 complete staffs. They were good people. I know they were good people. What's the problem? And I had to come to the conclusion that I was the only one that was still there. It must be my problem. Yeah, no, and that was the start of starting to learn how to be a good boss. I mean, plain and simple.
Right. Look at the clues. And then, Ashley, what do you see? Like, how is that? If we just try to elaborate on this title and spin it off in a different direction, I mean, working with a lot of offices across the country, like, what's the retention secret?
The secret is providing a good working environment for your team. It's allowing them to have, and when I say ownership, I don't mean actual ownership, but ownership over the systems that are happening, over the building a culture that someone actually wants to go in and be a part of every single day. Like that's why people are going to be there. It's not necessarily the state that they're in. I liked what you said about this being, you know, it's the state's problem, not necessarily your problem on how they got here or why they're staying. Like, oh man, I just love Colorado so much, that's why I'm going to stay in this dental office. No, that's not necessarily the case.
You know,
So yeah,
what's interesting is I don't know if dentistry in those roles is like a full-on career anymore. I'd like to think that I have a good relationship with a lot of the assistants, and I talk to them and follow up with them and like what's new, what's going on, what are plans. There's none that are like, oh, I'm going to do this for the rest of my life. They're just kind of like, I'm doing this, I'm going to do it for a while, and then like my ultimate goal is blah blah blah. Whereas people used to look at assisting or, you know, managing a dental office, or and maybe more so managing a dental office, but they were careers, and they're not careers anymore. So part of me is like, yes, you got to fight to keep people. But then two, I'm like, well, they're going to leave anyway. And I'm not saying you don't invest in them. You know, you'd like to keep them as long as you can. And I think like when I look at like what would be success with some people at those levels in the office, it's like they like me enough, the office enough, that they've learned all of the things and train their replacement before they leave, instead of just being like, hey, I'm out. But it's interesting because we'll also see, you know, people will leave because the grass is greener on the other side and they get a dollar more. Right. And I'll always talk to them like, you know, it's a bummer. You could come to me for $1 more, and I'm sure we could find things for you to do and, you know, bump you up. But if you feel like that just to move on for $1 more is more important, I would like you to think at some point about the culture that we have in the relationships and the patients, and we have a fun office and blah, blah, blah. And, you know, definitely more than a handful of times, they'll call you back in 3 months and they're like, can I have my job back? You know, because they then realize that culture is that important. I always have a hard time on when you know, sometimes you might let them back, but for me personally, I'm kind of like, when we get to that point, I'm like, you gonna do it again? You gonna do it again?
I've worked with an individual though who's let almost everyone back, and it seems to always work out. So maybe give it another shot.
I'm gonna
being one of those people. Not that I call.
I'm gonna have you like kind of do the retraining there, and then if we have to let them go, then you get to let them go too. Deal? Nice.
Fine.
I feel like I wanna take this chance and you know, we on this specific title we talk about the culture and people and don't be that guy. But I wonder, what if we try to rephrase it and say, instead of 10 states where dentists may see success retaining staff, what if we just run through the list and we just shut out what we think 10 tactics dentists may use to have success retaining the staff? Like, can we go through the list? And Aaron, starting with you, like what would be your 1 or 2 or 3 things, like very specific?
I would say let them know that you appreciate the work that they do each day. Even though it's not perfect work, even though some days it might not even be the exact work you want them to do, let them know that you appreciate them showing up and putting in the effort, and then you can kind of guide them from there. Then I have lots of stories about that stuff if you ever want to hear those.
Oh, I do. Can you give one more?
I would say communicate with them about what's going on in the office and what you're thinking and kind of what's happening. You know, one of those things where if you feel like you have the inside info, you feel more part of the group than if, you know, hey, somebody just showed up and then, hey, now they're not here. Where are they now? And somebody else just showed up. And, you know, it's like, if you just don't know what's going on, you come in and there's always something changing and you have no idea which end is up. Eventually you stop caring about which end is up.
And one more. This like golden nuggets, Aaron.
And one more.
I know you have one more.
I would say one thing that's worked really well for me recently is I will go to an assistant and say, so, you know, you came in with us, you came out of a dental assisting program. Is this the game plan? Is this the thing we want to do right now? Usually they say yes. And then you usually say something along the lines of, well, like, how good do you want to be? Nobody says, I want to suck. I want to be really good, of course. In that case, can I come to you when I see areas where you might want to stretch or improve or get additional skills? And can we talk about it? And they usually will say yes. Now, instead of me going to them to correct them, what I'm getting is I'm coming to you to help you in your career. So it gets accepted much more readily. Now, mind you, the first time you call them into your office to have that conversation, they'll go, oh crap, what did I do? And you go, no, no, no. Remember this conversation we had? This is that. I just want to help you out in this area. Oh, okay, cool. And then you can have a conversation about improving skills and that sort of thing.
Fantastic. So the question is, how good do you want to be?
Is this the thing you want to do? So there's got to be some sort of commitment. I'm an assistant. This is the thing I want to do. And then, okay, cool. How good do you want to be?
Fantastic. Ashley, what are your 2 to 3 golden nuggets?
Glad I got in there first.
I know, that was really helpful. He should have gone last. He's the one who has the most. Look at that from Brian. Look at that from Brian. Audience, if you can't see, he was flipping off Dr. Nicholas.
I was tired.
I would never do that.
I think it's I understand that there's a bottom line when it comes to overhead. Don't stress so much about staffing costs as the number one thing. So when your employees are coming, that we're after COVID. I mean, people are asking for more money, of course, in so many different areas for so many different reasons. There are other areas to cut costs and to provide for, pay for good team members. So don't kind of scoff, I think, at the $1 or $2, sometimes $5, honestly, that is happening in a lot of these areas, because getting good people and splurging, quote, on what you're having to pay, I think is something that is absolutely worth it over, hiring poor people.
So you're saying the
Poor
staffing
quality.
cost is already the highest cost you have in your business. Don't stress about it too much. It's the highest anyway, right?
Yeah, exactly. That's not the area that you need to be, planning to cut. So don't skimp on that, because then employees are, they're going to know that $1 seems more attractive, Look for ways too to provide, benefits if possible, or, and not necessarily benefits. I know not everyone can provide healthcare, that type of thing, but there's a lot of different strategies out there, and that's what people are looking for these days. So
awesome.
Do some research.
Do you have one more, or should we move to Brian?
Go to Brian, and I might have one. I'll raise my hand. I bet you I'll come up with another one.
I'm going to talk for 13 seconds, and then Ashley's going to have something here. Yeah, I'm gonna echo first kind of what Aaron was saying. What I hear is feedback. So give feedback and engagement. Right? It's like there's everyone calls their team members different things. I don't remember who it was, but I mean years ago they were like, they're not staff. Staff is an infection. Right? And so it's just like. Treat them like the people they are. I mean, at the end of the day, you have to recognize that you don't make money. You don't see patients by yourself. You do it with a team. So, putting the team first. There's different styles of leadership, right? Push, pull, but make it genuine, right? And if you're the type of person that really doesn't care about your team, I mean, expect to have turnover all the time. And it's fine. You'll probably still earn a decent living and you'll have a career, but people aren't going to like you. I think the other thing is clear expectations. And so it's hard to do a job when you don't know exactly what is expected of you. And so if you can't give them a list or, sit down with them and be able to explain everything, what is expected of them, and then you get frustrated or upset with them because they didn't do something that lives only in your mind, that's a pretty rough place to live, right? Like, you grow up that way with parents like that, you're probably seeing a therapist by the time you're 33 years old, right? Because you're just floundering and you don't even know what's going on. So clear expectations. And then it goes along with training, right? So if you're going to give them all of these expectations and they don't know how to do those things, and then you say, I'm not going to train you on that, they're probably going to bounce at some point. So be willing to train your team. I mean, the better you make them. Tiger, you and I have talked about this a bunch, right? If you're an assistant and you can learn new skills, you probably deserve more money, right? but the expectations then become higher. And so you can navigate them through years and years and years of growth, financially, educationally, job description, all of the things. So also just don't be a dick.
That's a good one.
That was the one I was violating early on.
I wanted to circle back on a couple things, and then I'll add my 2 cents too. When you say person who, if you are the person who doesn't like people, you will see a lot of turnover. Unfortunately, there are people like that, and we've all met dentists that just genuinely don't like people. I think the best thing I've seen is admitting that you don't like people, and then hiring an office manager who can handle the people side of things for you. That the only person you need to sort of like is your office manager with all the processes and systems. And again, you guys can push back on me and disagree, and we can talk about it. But I think if you're that kind of person in the office and you at least acknowledge that and you know that and you let other team members know that, hey, this is not your best thing, like you probably best clinical stuff, and that could solve a lot of problems in the practice. Ashley, do you have anything to add, or can I add my 2 things?
Oh, my one too was just extreme ownership. So like everything that's happening in the practice is your fault. Like the sooner that in your practice or your business, the sooner you accept that, the sooner you can fix it. And if it is you're being a dick, if it is, you're not paying enough, if it is, the culture is toxic, like if you just take ownership over it, then you're going to have more success in knowing how to fix it. The first step is admitting you have a problem.
Cool. I will just throw the one big thing that I see is if we talk about tactical to retain staff is doing morning huddles. I'm just still surprised by how many offices don't have morning huddles. I think it's one of the best things. I still remember I went to, do you guys remember Max Johnson?
Mm-hmm.
I sat at his office in, where he's at, in Arizona? Tucson. I sat in his office when he did the morning huddle. My jaw dropped. The guy can deliver a morning huddle. Like, I really wish he can record it and tell other people. And he just energized everybody. He went through the schedule. He didn't delegate it. He did it himself. He was very shy about it. And it was so genuine. Like, I still get goosebumps thinking about the way he delivered the morning huddle. I went after that, morning huddle, all energized. I wanted to go and kill. Like, all right, let's go. Like, what do I do? How do I bring patients? Like, can I go on the street and hold the sign? Like, come on, Max, you energized me. So I feel like a lot of people missing out, and especially on a retaining stuff, is like, and go back to what Aaron said, is sharing or communicating with the team member on what's going on. Who was that person who came in and left? Like, what's going on in the office? Talk about it during the morning huddles. And I think the last one too is on my end is like that creating a career path, not treating your team members that they owe you something and they're part of your team. Try to treat them as you actually owe them, and you owe them a career path. And try to flip the coin and say, I'm in charge now of your career path. If you're gonna, what's the saying? If you're gonna attach your wagon to my train, that means I'm in charge of your career now. And so take the responsibility and help the people grow. So did we say 10? Like, did we cover 10 tactics?
I gave up 3
I can't
already,
count that high, so I'm not sure.
7 to 10 is a good average.
Right. That's why Brian has only 10 offices, because that's all he can count. Like, he can't.
We covered enough to have statistically insignificant data like our states.
Right.
So
to
Tiger,
be fair,
go ahead.
To be fair, they used the U.S. Census in that survey, so I would say they had quite a bit of data. It just that's a very small percentage in difference.
Yeah. But Tiger, I wanted to kind of piggyback on what you were saying. It's like, one of the saddest things I see is a long-term assistant or a dental employee that comes to us for a new job because their doc sold the practice. They didn't like the new guy, whatever, and they're making really great money and they can't do anything, and they're trying to replace that income, but they can't do anything. I can't pay you that. You can't do anything, and so we need to start you here. And it's just sad, and I always kind of feel it's partially our responsibility to make sure that if they're staying in the practice, that they're learning some stuff, and they're moving and getting better in their career path. But I'm 100%. That's just, it really bothers me.
I saw one at an
Guys,
office that I was looking at, and I think his lead was getting paid like 40. His lead assistant was like $47 an hour, and I was just like, dude, you're gonna.
whoa.
I'm sure that every time she wanted a raise, he just said yes. But I'm like, dude,
Yeah.
you're gonna take a 50% pay cut, and anywhere on, even outside of the 10 states. It's wild to see that sometimes.
Wow.
But it's interesting that
Wow.
despite everything that we're saying about, like, there are some bad bosses, that other article is dental hygienists and dental assistants are ranked in the top 25 of the top healthcare support jobs by U.S. News and World Report, which I think also reported on dentist salaries going down from last year to this year, which was not in our list because it was an article from February, I think.
Yeah, so if you don't mind, let me take a step back and just read the title so that we're on the same page. Dental hygienists, dental assistants ranked on the best healthcare support job list. So that was dental hygienists and dental assistants were ranked in the top 25 according to U.S. News and World Report. The rankings were created based on 7 metrics: median salary, unemployment rate, 10-year growth volume and percentage, future job prospects, stress level, that's a big one, work-life balance. So for more the publication methodology, click here. Here's how the professions stack up on the list of 30 healthcare support jobs. Dental hygienists ranked number 2, median salary $77,810, unemployment rate 1.7%, number of jobs 19,000. Dental assistants ranked 22 on the poll, median salary $38,660, unemployment rate 3.7%, number of jobs $30,100. No, I mean number of jobs. I'm sorry, 30,100. Very interesting numbers. Ashley, what do you think?
Sorry for the pause there. Can you hear me?
Yes.
I think it's interesting that the number of jobs for I feel like that number is low. It says number of jobs open 19,000. I feel like every single office in the U.S. is looking for a hygienist. But I mean, it makes sense to some extent. I also think, like we said earlier, that I think hygienists were some of, when everyone came back after COVID, there were less hygienists that came back. There was many who were in positions who were not having to go back to work. So I think, because hygienists are in such high demand, that then kind of makes, because they're in demand, those positions are usually made, a little as comfortable as possible, which makes sense. And these are, support roles within the dental office, but even at higher rates and higher salaries, it's still more valuable to have a hygienist, as long as they're, meeting 3 times their pay, hitting those benchmarks, than trying to do hygiene yourself, when the time and energy and money that you put into becoming a dentist is, your skills are better used in other areas. I kind of went off a beaten, tangent there, but that's my first thought.
That makes sense. Aaron, when you look at the unemployment rate of 1.7% for dental hygienists, do you believe that?
So we said we could curse on this podcast. Is that what I heard?
Oh, hell yeah.
Okay, I'm calling bullshit. I don't know a dentist that doesn't need a hygienist. Not a one, not a one. And I would say the same thing for the dental assistants at that number. It's like, if they're not employed, it's because they don't want to be employed. I can get you a job tomorrow. I can get you a job within 2 hours if you're a hygienist. Like literally within 2 hours. It would take 1, maybe 2 phone calls, and we'd have it all sewn up. That's just crazy.
It's interesting. It's interesting also because it talks about a 10-year growth percentage, and the number of dental offices is going to continue growing, because also the number of students coming out of dental schools is also growing. So to me, that's also like a moot point. I'm like, yes, we keep putting all these people through school. There's going to be more offices, more doctors are going to need more team members. So yes, this sector is going to continue growing. Sure.
So while we were going through this, I quickly Googled number of active dentists in the U.S. It says there are 202,536 active dentists within the U.S. And how many hygienists we have going on here? I mean, it's just like only 19,000 jobs? No way.
No way.
Well, just because they're an active dentist doesn't mean they own a practice.
Okay, so let's say there's 3 dentists for every practice. You're still
Okay. I'm just saying. Just saying.
Just even think about it. The way we use it at Zen, there's 160,000 dental practices in the U.S. That's our rough estimate. That's the closest number we got. 160,000. I mean, come on. At least 130,000 offices need one hygienist.
Yes.
So the number of jobs is like 10 times more than
Aaron,
what is listed here.
This conversation of like, where did everyone go? Have you heard anything that sounds like remotely intelligent? Like, I feel like everyone, it's like Atlas Shrugged. It's like all of a sudden people just like disappeared, you know? Have you heard anything where you're like, yeah, that's probably really what happened?
The thing I heard a lot of as we were coming back was hygienists not being happy with the protective protocol for doing what they're doing. And I really think, and I can't say that I heard this, but I really think that whoever it is that they're listening to about how to conduct themselves in a professional practice was telling them, you need to make sure that you have these 15 things in place to make sure you're safe. And as with a lot of folks that were telling dentists what they needed to have in place for the dentist to be safe, a lot of us dentists decided that that was a little overkill. We didn't really need all that stuff, and we were going to be just fine with a little bit more scaled
during
back
COVID, I had a group chat with the whole team, and we would keep tabs on each other. I was in New York City, by the way, so we were closed for 113 days. And it was perio and hygiene that had the most, like the biggest asks, right? Like they're like, oh my God, this is happening, that. And I'm like, where are you guys getting this? And then one of the hygienists told me that the other one invited her to some CE group that she was doing CE with. So I joined it as a hygienist. So they didn't know I was a dentist. They thought I was a hygienist. And that's exactly what they were saying. They were like, if you're working for a dentist who does not give you 20 minutes to sanitize your room in between appointments, then you need to go somewhere else. Like, that is not the dentist you should be working for. That's like 20 minutes just to wipe down a room.
Yeah. Well, I mean, the other thing too is we've had accelerated hygiene in my office for more than 2 decades. Okay. And for about a year, we could not find, and my hygienist who we started that with has been with me for all those more than 2 decades. So she has been a fixture. And then we had a second one.
The accelerated hygienist.
Sure. Accelerated hygiene is that just like a doctor works with an assistant, your hygienist works with an assistant. So as a doctor, you don't tear down your room and wipe it down and set it back up and get things ready for the procedure and take your own x-rays and maybe take impressions. Like, all these are things that you can delegate to an assistant. So for the hygienist, it's the same thing. You know, how is it necessary for a hygienist to tear down a room and wipe down the surfaces and set it up for the next one and take the x-rays? You know, they might want to review the medical history, but they don't necessarily need to take the medical history. So the idea is that just like you have an assistant for the doc, you have an assistant for the hygienist. Therefore, you know, if you actually look at the amount of time that a hygienist puts an instrument on a tooth or a prophy cup on a tooth, and you total that up over an hour appointment, it's less than 30 minutes. In an assisted model, an accelerated model, that hygienist gets 30 minutes every single patient to do what she needs to do. So she actually has slightly more time than she would have, because guess what? The other thing she's not doing, she's not waiting for the doctor to come in and do his exam. Okay, because the assistant is waiting for that, because she can do that. You don't need to do that for the doc. So anyway, for about a year, we were filling that second position with temps, because we couldn't find someone to take a job full time for different reasons. And we had 2 or 3 temps that came in. They didn't know it was going to be an accelerated situation. We told them, look, just do what your assistant tells you to do. You'll be fine. They did. And at the end of the first day, both of them said, I would be happy to come back. And we had one lady that was with us for almost the entire year, working 2 days to 3 days a week in an accelerated program, and who said, I'd almost rather work here than on a regular kind of shift because everything's done for me. All I have to do is like actual hygiene, you know? And so, man, I'm way off on a tangent. Where are we at here? This is if you go into a dental hygiene program, typically what they tell the hygienist that they're graduating is, don't let some doctor talk you into this thing. They're just working you extra hard, and they're making a bunch of money off you. Most guys I know that run an accelerated program or have hygienists seeing patients more than 1 an hour are also giving some sort of a bonus or a little extra something because they're doing more work. They get more pay. No big deal. But it doesn't have to be harder on them. It doesn't burn them out. My hygienist of more than 20 years doesn't have carpal tunnel syndrome. She doesn't walk around in braces all the time, and or something of that sort. It works out just fine.
Brian, you just came back and your camera is horizontal, not vertical.
Sideways.
So sideways. Just a heads up.
I'm just going to do this to mess with you guys.
Right.
It's working.
So to Brian's point as well, though, I mean, like 96% of hygienists are female. And so after the pandemic, like so many, also there was quite a few older generation of hygienists as well. I think a lot of people retired at that. They took early retirement and decided they were done at that point. And then also, realized that again, 96% female, a pandemic happened. There are, elders that need to be taken care of or children that need to be stayed at home with, and they're realizing that they can stay at home and work from home. So I don't think it was necessarily just our offices are not keeping us safe, we're going to quit. I think that you're looking at a demographic that's largely female, and there are social pressures that are put on them in other ways. And so they don't, they're having to take care of kids and family members, and again, potentially retiring, because there was quite a few, many older generations within there as well, like anyone else. But yeah, other thoughts as I was silently Googling over here as we were learning about assisted hygiene.
No, that's a good point, Ashley. And I read a statistic, I can't remember where it was, that like 35% of all doctors over age 60 retired coming out of the pandemic or sold their practices. So I was 60. I sold my practice coming out of the pandemic. I don't want to have to rebuild it. Happy to come in and work somewhere, but I'm just kind of done, ready to move on to whatever the next thing's going to be.
Yeah, and I just wanted to say very quick, it's there was this notion in the industry that, hey, a bunch of money were thrown at the people, so why they got spoiled and stuff. There's some truth to that, but at the same time, I'm sitting and thinking, like, a $1,200 check 2 times, is it really like a reason for somebody to call quits and not come back to work? It's not anything gigantic, in my opinion.
No.
For people to like stop their career and become greedy and all that stuff. It's just I find it a little laughable. So to me, I think there's just like a deeper issues within an industry where maybe some people didn't feel appreciated and stuff like that, or just there's no consent on what necessarily is a good environment for hygienists and stuff. And Brian can talk about it. Obviously.
But I also look at this. It's kind of interesting because some of the articles that were in our list here, we're talking about some of these companies either acquiring or starting offshoots that have to do with things that are kind of like temp agencies and placement agencies, labor placement, that sort of stuff. And when I met with a guy who started and sold a placement company and is now starting another one that happens to be medical and dental. And it's interesting because the way that they market to assistants and hygienists is you be in control of when and where you want to work. And I think we're at this weird point in time where like you ask an 11-year-old what they want to do and they're like, I want to be a YouTuber. It's like things are different. And so it's like they have that opportunity now. And is that in a way where the industry is going? And I've talked to some assistants and hygienists that do that, and they're like, no, it's great. They're like, I actually still work 4 days a week. I just work 2 days a week at this place and 2 days a week at that place. And they have pretty much 100% consistent work on those 2 days all the time. And then if they don't feel like working, it's not like they're getting docked from their like PTO or something like that. In a way, it might be short-sighted. So I talked to a few people applying to jobs that were temping, because they get a little more through these temp agencies, and temp agencies may have shot themselves in the foot by offering that too. But they were temping, and then they were doing it because they were getting a bunch more money, and the plan was, I'm gonna bankroll, I'm gonna save money, I'm gonna get my home, and then I'll get, you know, a permanent job with like the work family and you know, set down roots. And they're trying to get loans for houses, and these banks are like, you're a temporary laborer. Like, you have to have employment for 3 years before we can loan you money. I heard that a couple of times. So it's just interesting. I think the landscape is changing, and I don't think anyone really knows where it's going to end up, but people want to move around. They might not want 4 days or 5 days at your office.
Yeah.
Agreed.
And then just on this, Ashley, when you look at the median salary of a dental assistant of $38,660, what goes through your mind?
I mean, I think that no one's able to stay there and live there, you know. That's like Brian was saying, you know, a lot of times, and going back to our last comment, you know, creating career paths for employees is important so that they do have skills, because I mean, 38, we're in an economy now where that's not viable to have kids and retire. Definitely not retiring at, what is the retirement age, 65 when people get Social Security now? Like, it's not feasible. So I mean, that's, people are not going to stay in that role, is my opinion.
Feels like there's this titanic shifts in the industry, in the way that there's this, what Brian said about what was the movie, The Beautiful Mind?
Mm-hmm.
When you start connecting the dots and different things. From one standpoint, I feel like the divorce rate is really high, because the in the past it was like, well, that's a substitute income in the family, right? So hypothetically, if it's a female-driven industry, your husband makes most of the money, and for you to have a second income of $38,000 is actually not that bad. But with now divorce rates being so high, that's not a second, it's a primary income.
Mm-hmm.
Right? And you're raising a kid, and a lot of times, so I'm curious for Brian and Aaron, going back to like your practices, how many assistants you had that were single mothers, or like what was the ratio of married, non-married? And I think that's interesting, the dynamic. And then at the same time, this again, like, talk about the titanic shifts, is like we want people to stay in the practice for a long time. But if that's the median salary, how are you going to keep the people? Again, going back to that career path, Ashley, we've been beating on this dead horse on a career path. But if people can't see how they can make a jump from 38 to like a hygienist 77, not necessarily becoming a hygienist, it's really hard.
Mm-hmm.
And then we're essentially creating it's not a career path, it's just a launch pad for something next thing that the person is going to do. And that could be, I don't know, manager of McDonald's after she's a dental assistant. I have no idea, but it's just like, it's really weird to look at this number.
I mean, I look at this, and I think you're right. Typically, dental assistants were a second income. Over my career, I've had one dental assistant that was just a single person. Everybody else was either living with their boyfriend, so again, 2 incomes together, or married, 2 incomes together. And the one that was on her own, like, she was my highest paid assistant. She was also the most capable assistant I had. So to pay more for more capability, and to where they pay for themselves, and it makes total sense, is one thing. The other thing too is that over my career, we always had like the core, and then there was all these people on the outside, and your core stayed with you. They were paid better. They made things run. And then you always had these people, and you were always training. You were always hiring. I think in small towns and more rural areas, there's less opportunity so they'll tend to stay longer. There's a certain amount of prestige for working for the doctor in town, that kind of thing. But I think we're seeing that less and less, and I just think that the opportunities to be mobile and to be flexible and to earn money from home has just increased exponentially, and so there are more choices. And so now, if you're in a city, you have to compete with every other employer in the city. But now, if you're in a more rural area, you have to compete with a whole bunch of other opportunities. So I just think it's a little tougher.
It's like you got to look at it from every single angle too, right? I mean, I look at it and like they don't get taught much in their school, right? But most have a high school education, and so I would love to see all of my assistants stay with me and grow and have this career and everything. But I'm also like, well, what's the other option? You have a high school education. So when we look at the numbers, and I'm not trying to be a jerk, but like you look at the numbers and you're like, yeah, 38,000, 37,000?
30.
And
Yeah,
it'd be interesting to see what the comparison is between that and other sectors where they are just high school employed. And so I think you have a stable home. I think if you're like a work home, you know that you have a stable income. If you can find a place that has benefits and that sort of stuff, and then you see that you have a path forward, like you might not ever end up making $65,000 a year, but it's also like, what is it seems sometimes like the expectation is, well, I'm a dental assistant and I work for a dentist, so I should be making more. And I'm like, if we strip all of the other stuff away, you're high school educated and you have a stable job. It's also like, that's not the worst thing. There's tons of people making $15 an hour that don't have a stable job. That's me being optimistic.
Right. So I think if we look back at that report, it says, the occupational therapy assistant is the number one rated job with this median salary of $61,730, and then dental hygienist median salary we talked about $77,000. Then the number three was physical therapist assistant with this median salary of $61,000. The one that doesn't make any sense to me is medical records technician. Like, do we still have medical records? And their median salary is $46,000. So again, it's just very interesting to me that how it all works. And again, I do agree with you in the sense that we need to be realistic when we look at what's going on, and these are high school educated people and things like, but we also need to look at the needs of each individual office and where we at from the office standpoint and how things are changing. And I think that's where my prediction is that number is going to go up. Either we want it or not, it's just going to go up, right? And I don't think people, the way I look at the United States, I don't think like tomorrow things are going to change and everybody is going to stay together and the divorce rate is going to all of a sudden drop. It's just not going to happen, right? So it's just going to be the single income thing, and it's just going to drive it up. That's just my thought.
Yeah, like you, I Googled, best jobs you can get. This is actually off of Indeed, with a high school diploma, and it went for everything from about $15.50 an hour, so you double that to get the yearly, so about 30 grand, up to where was it? Not that one. This one, transportation inspector at $74,000 per year. So apparently there's a vocational trade school there, but then in everything in between, police officer at 55, a plumber at 50,000, hotel manager at 50,000 a year. So there's lots of opportunity, lots of options other than being a dental assistant.
Ashley, what's your take on what we just discussed? And we can wrap the subject.
My take is that Brian's a jerk. Oh, just kidding.
Wow.
Just kidding. I'm kidding. No, I mean, I it's a very, very valid point. I think I'm just far too motivated. Literally all of like my friend group, we all are college educated with no children, but nobody has just one job either. Like everyone is, Brian, you mentioned they're doing temp work, and it's just a different generation, and maybe I'm in my own little Colorado microcosm, which happens a lot. But yeah, it's interesting and something a different way to look at it, I guess, than
Well,
what
it's
I was
tough
used
too
to.
because, like you
Yeah.
said, I mean, you think about things like I want my hygienist to produce 3 times more. Well, a lot of the younger hygienists are like, they come out of school and they're like, I want $57 an hour, and I'm like, well, you've never even cleaned someone's teeth outside of a dental school,
Right.
right? And so they're told to ask for these
Totally.
really big numbers, and then you're like, okay, well, you're going to run 2 columns, and they're like, well, I don't want to see that many patients, and you're like, so how does this work then, right? And you look at the same, you put your business owner's hat on and you're like, I mean, I would freaking love to pay $35 an hour to assistants. I see the hard work that they do and I think that they should be compensated for it, but then what happens? How, as a business owner, do you actually afford that unless you're willing to start writing checks
Totally.
out of your own pocket? And so it's a catch-22. It's a whole societal thing. I mean, you could argue that the people at McDonald's work their freaking asses off, and they should, but it's such a difficult
Yeah. If they would,
topic.
if they would, McDonald's wouldn't be putting robots instead of people, right? So like that's where McDonald's is going, like a fully robotic McDonald's just opened.
I was
opening up
talking to a
somewhere.
friend the other day, and
But
he said
I think
he's planning his trips for 2024, and he wants to spend a month in Shanghai. And I was like, why? And he's like, I want to find a robotic hygienist.
yeah, good luck with that. Uh, uh, I, I don't know. I think it's an interesting subject, and the more we talk about it, we can go on tangents. But should we go into the next subject? Talk about the how much does it cost to attend the best dental school? Is that
I think
interesting?
we were just talking about
Or should we
technology.
go
There's so
into?
much. We have so many like tech AI articles out there, right?
Yeah, let's go into some AI. Yeah.
All right. So that's the talk of the day. All right, let's see. We've got artificial intelligence in dentistry, streamlining orthodontic care. Woo, that's interesting. So, some company, what is it, Farmington, Connecticut, many factors may influence therapeutic decisions in orthodontics. For example, orthodontists may sometimes inaccurately interpret scientific data. And whatever or not they will perform an invasive treatment or both, or tooth extraction may not be based on objective criteria. Seeking to streamline orthodontic care, researchers from, I don't think they understand what orthodontic care is, but the artificial intelligence tool that will give a second opinion to help clinicians choose the best treatment options available. So pretty much they're talking about companies like Pearl, about what they do, and basically they're saying artificial intelligence has increasingly more application in dentistry and can help dental professionals to improve the precision of diagnostic treatment execution and planning and daily management of the clinic. It can also help with patient virtualization and has an enormous potential to enhance clinical workflows. In the field of orthodontics, AI can help improve the diagnostic accuracy of orthodontic treatment, thus improve the quality of work. Um, what to me when I read this were more like orthodontic care, meaning specifically to the orthodontic. They talk about some more stuff in general about AI and general dentistry, I think. So, Aaron, I heard a lot about AI, meaning it's a nice to have, but hey, come on, like I can spot a cavity. I can spot these things. Like I'm not gonna go every time I scan or I do an X-ray, then trust some AI thing that it's gonna tell me what I missed. What's your take on this?
I think we already have AI, especially in ortho. I mean, all of the clear aligner companies have some sort of a computer program that decides how far can we move this tooth with each tray, where does it go, how do we set it up, And yes, you have people on the front end going, I want this to go here, here, and here, and here's my diagnosis. It's only one more step to get them to let the computer do the diagnosis. I have a good friend that works in pharma, and he's always talking to me about machine learning and about machines and AI being able to learn certain things. You correct it, you correct it, you correct it, and pretty soon it gets better and better and better at it until it can do it faster and better than you can because it doesn't miss anything, and you might.
Yeah, I would say the other thing that's interesting about
Ryan,
it,
what's
to
your
to keep going on that, is it doesn't miss anything and it doesn't get fatigued. And when you look at, uh, I won't say when you look at, I can point to myself. If I have a crazy day, I will generally go in the next morning and I will look at my x-rays from like the last 2 exams that I did, because that's probably the most likely time that I may have missed something. And AI is just a flashlight in a sense. It's just pointing you to areas that it sees where it's like, hey, I need you to look at this. What it doesn't do when they're talking about some of this stuff that Tiger that you were just reading off is like, it'll help with workflows perhaps, but like it doesn't tell you what to do. It's just saying like, hey, there's a thing here that you need to look at. The clinician still needs to determine what the procedure is, what the material is, all of that sort of stuff. But also in orthodontics, one of the interesting things, Aaron, did you ever like read cephs? So like, it's shot from the side of your head and then the sensor's here. And so not everyone is completely symmetrical. And then, if the person is not 100% straight and they turn their head a little bit, you get these overlaps and then it's human judgment. And so I would bet that AI will, and there was an article in there that was talking about using AI for cephalometric interpretation. And I would actually bet that as that learns, it will get more accurate than the human eye. Because I went through an orthodontic class where it was 3 days, once a month for 7 months, and we would go over a dozen or so cephs, I think, each time. And as everyone was doing it, everyone had different numbers. And I would bet that AI can actually dial that more.
Interesting. Ashley, when you look at things like that, and especially when they claim that daily management of the clinic, what bells does it ring for you?
Man, I think if we can utilize AI with as far as daily management of the clinic, if they can utilize AI as far as, and I don't know if this will happen since there's so many different, insurance plans and that type of thing out there, but with regards to billing and claims, if we could 100% automate those based off of like if it was a flow, right? So a lot of times claims are denied because, well, we don't have the right x-ray, we don't have the right thing. If the flow is completely automated to where that the x-ray is being read by AI that's showing the whatever decay or whatever it might be that's needed to then process and go down terms, like I think that would be super cool. And even like Brian was saying, just minimizing human error. Not in even terms of dentistry. I have a friend who had her greyhound who's having massive pain and they couldn't figure out why. And she had it at this one vet forever and ever. And they're looking at the radiographs. They diagnosed it as one thing. Literally last month, another vet is like, no, her neck is clearly broken. You can see it in the x-ray right here. And so, there's absolutely human error in reading radiographs. And so if that can be automated too, I think that would.
I think AI too will end up in the hands of the insurance companies, which I'm sure is going to make all.
Oh, it's gonna go both ways. Yeah,
but
go both ways.
The positives there will be that your freaking claims should be paid like 18 seconds later, because it's just going to go through and it's going to be like, yep, nope. I had an employee who worked at an insurance company, and at the end of the month, all of the claims that they didn't process, the manager would walk the floor with a trash can, and you just throw them in the trash can and they'd move on to the next month's. And so it's a speed thing with humans too, right? So once AI gets in there, it's just going to be super fast processing all the claims, and it'll take the AI on our side, the clinical side, which has shown them that there is indeed caries here. There is indeed bone loss. Pay the damn claim. So I think that will be interesting.
Imagine AI actually says that to Delta Dental.
When we need to be scared is like 2 months from now, when one of these articles is like, Delta Dental buys, and then one of these AI companies, then we all quit.
Well, I got to say, I think no matter how pure our intentions are on the front end, it's always the game. I feel like it's always the game with the insurance companies. There's one more thing, there's one more hoop, there's one more deal that you have to do to make that work.
In an ideal world, imagine if the AI is so synced with your software that like you mark the patient as in the room and it's like, boom, here's your imaging software. Like, we're not going to let you proceed until you have a diagnostic image from today. And then it's like, great, boom, you do your work. And it's like, nope, your narrative is not complete, or your note is not complete. Like, you can't let the patient out of the room until this part's done. And it like helps you get through each thing that you need to do. And then it copies itself with its measurements and all of its little diagrams and stuff, which is going to go to the company, the insurance company, who's going to be using AI as well. And then I could see something like that at some point, but it almost seems like it would make everything too easy, and that's just not life.
Yeah, you know, the other thing I wanted to say, to your point, Brian, about the, you know, at the end of a hard day, you go back the next day and look at your x-rays and like, oh goodness. I mean, we are all familiar with that feeling of going in to do the work that you diagnosed and going, why did I diagnose that? You know, and it's like your opinion changes, that sort of thing. For years and years, they've known that you take a physician, you put him on a 24-hour rotation, and about the last 12 hours, he's almost useless. You know, like there's just so many mistakes that get made, and yet they still put physicians on 24-hour rotations, even knowing that. So I think the knowing of it is one thing, and then figuring out what to do with that knowledge is maybe a
well. How
whole
about
separate
this thing?
kind of
Like,
thing.
you walk into the room, and before you can even say anything, your patient's like, well, my appointment started 3 minutes ago. Thanks. And you're like, God damn it. I got to and I've already looked at her x-rays, and I got to tell this peach of a human being that she needs 8 crowns, 4 fillings, a root canal, and 2 extractions. And so you know, it's human nature to dance around, and you know, you're like, well, she's already upset. Do I want to upset her further? So you're like, maybe 2 of those crowns could really just be fillings. And then what happens is what you just said. You see this thing on the schedule, you look at the x-rays, and you're like, why the hell am I doing a filling on this tooth? You know, like, so there's just so much that goes into it.
Yeah.
But AI doesn't have feelings
Well,
like a dentist should.
yeah. Or you, yeah, or even between 2 docs, or the doc and your associate, or those kind of things. It's like, why did they diagnose that? Now they're in my chair. I'm supposed to be doing this thing. The patient's been presented, the whole deal. And it's like, can I in good conscience do this treatment, or do I need to talk to the patient about something different? And then support whoever made the original diagnosis, even if it was me, and get them to the thing that we really feel like they need.
Yeah, I feel like this is an interesting thing, because with dentistry, it's so hard when people say, are you a good dentist, or what is a good dentist, to find a good dentist, right?
Yeah.
So, and a lot of times when we ask our patients, I mean, I don't have a practice, I'm just saying in general, when we ask patients, like, they will say, oh, I love my dentist. And nobody says it was the best filling or the best crown. And it's always how you made me feel and things like that. And maybe in some sense, AI brings that playing field of knowing where your dentist actually rates on this whole thing, like being on a quality side of things.
You know what else is interesting?
Just a thought.
Now that I hear you say that too,
but
I remember like during consulting with some older dentists, and hearing this multiple times, there like an inability to connect with the younger generations, and that the younger generations don't believe, they're more skeptical of humans, right? So like, therefore they're more skeptical of the dentist, the doctor. And so what I found is, it's actually in one of the offices is right in a very large tech community. And so if I know that they work for a tech company, I just lead with it, because they're gonna perhaps believe AI more than my interpretation. And so your acceptance of the treatment, it goes up, because they're like, well, yeah, I trust AI, I trust tech, so if it says it, it says it. Let's do it.
Yeah, I mean, one of the things that I will not present treatment without a picture anymore. It's like, you put a picture up, and it's like, because we're such a visual community these days, you put a picture up, you show them the crack, you show them the decay, you tell them how to read it. I don't ever want them to have to believe me.
Yeah.
I want them to be able to see it for themselves, so that they can be convinced it needs to happen. And that cuts your presentation time easily in half. A lot of times you put the picture up and they go, oh my gosh, what are we going to do about that? We're done. You know, you just present what you're going to do and you keep moving. Yeah, but I see AI as a more sophisticated piece of that same technology of putting that picture up and being able to explain what you're seeing and why you think this tooth needs treatment or this part of your mouth needs treatment, et cetera, et cetera.
Yeah, and I feel like just my 2 cents. If you try to steelman the position of a patient, like a tech patient, Brian, that you described, probably they look at it as it's your opinion versus opinion of like 1,000 different X-rays put together and analyzed by either other people and things. Basically, it's a scale. It's multiple people's opinion versus your own opinion, like one doctor opinion, and maybe that's why it's winning. But in general, it's just an interesting direction that now we're looking at the assisted things, and I just pulled up the BOLA thing that now we're talking about being able to dictate your notes into the practice management software, and that ties right back into this where was it, artificial intelligence. What it does talk about the daily management of the clinic. To me, that's where the interesting part of the whole AI thing. The clinical is interesting. I talked to Parole guys, I talked to Overjet guys. Not that we're recommending or promoting any of these companies here. I think we all have friends at these companies, and I highly admire all of them that they're doing these things in their own way of different things. But there is some I think the two skepticism I heard is, one is it's just a toy when it comes to, I'm going to use it once or twice and then we'll see what happens. But the second biggest skepticism is on the insurance side. If the insurance company gets a hold of it, and not necessarily gets a hold, they probably already have, but just in general, how would that affect the industry? But it's a lot of things, Ashley, since you're back, a lot of things in dentistry is repeat stuff, daily like the checklists and morning checklists and evening checklists. And usually when you look at any of the checklists, when I go to offices, they're all posted all over the wall. And it's like, I mean, come on. Who does it, right? Like, how many people actually? It's only Mark Costas in his offices will do the daily checklist and the evening checklist and the end of the day checklist. But everybody else, probably it's just like lost somewhere. So I'm curious, how do you look at things like that when you especially see like BOLA AI, like now you can read your notes into the software and you don't have to remember the damn thing, and you can move on with your life without sitting down. I mean, it's a process. Like for a lot of doctors I see, they finish with a patient or they finish with a day, they walk around, they go get a tea or coffee, they chat with their team, and they're trying to delay the thing as much as possible. And then, all right, I got to do my notes. And it's usually like, I got to do my notes. And they just sit down, put a cup of coffee or tea, and then they do their notes. Now it's like you just read the thing and you're done.
I think that any time that there's any potential to automate something or systemize something, I mean, shout out to Sydney Robinson, who I work with every day, and the girl, anytime she can automate a system, is like, let me figure it out. Like allow her to have the time to automate something, and that like this has so much capacity for that. It's exciting because there's so much more room for other things to be done. Like some of those things, like the actual paper, that's a time suck. And I mean, to be fair, Tiger, I mean, we might be a little dramatic. I know I can be dramatic, but that may be a little dramatic. But I think we're I know, guys. Thank you. Anyway.
I think what you need is to tie your checklist to the lock on the front door, and so no team members can leave until they've all been checked out, and that will release the lock.
Literally in my
and then
head
everybody
thinking
can
like
go
an
home.
actual
I think that's
robot that just stands at the front door and it like scans the and it's like
that's how we're
checklist
using
completed,
technology.
and then it moves and lets everyone out.
It's hilarious.
But I will say that back in the day, there was a program called Dragon Naturally Speaking, and I tried to get it. I tried to train it so I wouldn't have to write my notes. And the thing is, it got stuff wrong so much that I would curse at it, and then it would transcribe that wrong, and I just gave up.
Look at how all
it was
this
all,
stuff
it was all
is
done.
like.
But
the idea is not new. AI is new, but I mean, when I was in residency, when you were in any surgery on call, you would call this number and you would transcribe your notes, and then someone would listen to the voicemail and type it up so that there was like a duplicate of what happened. Well, that's exactly what this is doing. It's just skipping the step of having a person type it up. This is not a voice transcription. Freaking Open Dentals had that for how long? For like perioprobing and stuff.
True, true. Yeah. Physicians have been doing this for years. They just, they dictate all their notes, and then
Yeah.
they have a transcription service that does all that. The system I like the best was we used to have and because so much of what you say is the same over and over and over again, we had a label made up that would go on a paper chart. It had the basic thing there, and then had some spaces where you had to fill in, like, the color of this or how many carpules and that sort of thing. You could do a note in 10 seconds. Now, even with going onto the computer, it takes longer than that. It takes much, much longer. I could do a week's worth of notes in a half an hour, and now I can't. Even
I
with
freaking
having
hate notes.
templates and all that.
I'm
sort of
laughing
thing.
because one of these ones up here, Tiger, is Oregon lawmakers advance bills to increase supply of dental assistants. And I just noticed that Oregon was not on the top 10 list of states.
Yeah, it's interesting.
They're
The
trying to move up.
connecting those
Trying to move
dots.
up.
I wanted to wrap up with that title, but before we move on, I get really pissed when I hear AI used by my competitors, and then because Brian, when you just said like technology, the idea has been
No.
around. AI is new. AI also is not new, right? So it's just a bunch of models trained on certain things, on certain specific things. And when I hear some of my competitors, even some of the vendors I work with, start using the word AI, it just gets me because it's not necessarily the application for AI, right? So like to me, AI, when I look at the true application of AI, what Overjet and Pearl are doing, to me, that's AI. That's, you're taking some of the things specific to the practice, and you have the case for the reinforced learning, meaning for that specific practice or that specific doctor, you can train the model specifically for that particular case. So if we're just taking ordering and we say we have an AI model that will price shop it for you, there's no AI. It's just a bunch of data put together, right? So I'm sorry, just don't make a glamorized thing that you can go to a dentist and say it's AI thing, and now I'm going to charge you more, right? So let's get it straight. And so AI, like going back, Ashley, to what you were saying, like when AI says, like, hey, it's the morning, you clock in and it's like, hey, did you turn on the air compressor? You're like, yep. And do you know that you have two air compressors? You're like, yep, I'm good. um, do you know your nitrous oxygen tank is low, it's like below 25%? Yep. Should I get the replacement? Yep. That's AI, right? But if it's not that, just don't talk to me about it. When it comes to like daily management of things
That's
of the
like when,
office, I call
remember
it
the fad
bullshit.
of
So
everyone putting the letter I in front of their like new product because the iPhone was cool?
Yes.
yeah,
I
yeah.
vegetables.
Yeah, and I talked to someone that it was a pretty smart thing when they said AI is going to be everything. It's just we at some point it's just like web in 2000s. We're just going to early 2000s. We're just going to drop the word web at some point, and it's just part of the process. Normal things.
I think we hit a
You
nerve
know,
with you,
there's a
Tiger.
Yeah, you
there's
got me
another
going.
interesting one down here that I totally missed. Dental tourism market to reach $21.5 billion globally by 2031.
I don't know. Ashley rated it at like 4. I thought that was a fascinating story, but maybe we can keep it till the next time and just finish up with Oregon.
I mean, there were a lot to look through. I mean, now that Brian's looking at it, let him have it.
Yeah.
But
I would
yeah.
say I just came back from Costa Rica, and they were saying that a lot of what helps develop their country is the tourist dollar. So they're really concentrated on that. And apparently, dental tourism is a big part of that, and it's
Aaron,
growing
we need to
exponentially in
talk
that
after
country.
this.
So
Uh,
that's interesting.
I want to get out of this country. No, yeah, and we'll
Oh,
surf a lot.
we need to go surfing.
No, just the dental tourism thing is always interesting to me because, especially when I was in New York, there's so many people from other countries, and they're like, "Oh no, I'll go home and get that done." And I would always just I'm just genuinely curious. I'm like, "How much is it going to cost at home?" And let's say it's going to be like $10,000 in New York, and they're like, "No, it'll probably be half of that." And I'm like, "How much is your ticket?" And they're like, "I don't know, it's like 1,200." And I'm like, "All right, we're creeping up on that price. How long do you have to go? Because this procedure here would take me, say it's like a full mouth rehab or something, or like a bunch of crowns." And I'm like, that's a few weeks. How much does that cost? And I never saw it saving all of that much. But what I'm seeing in Texas is it's a different group of people from a different areas of the world, and the dentistry comes back. And I've had this happen a few times, and I'm like in the middle of, I think I've done at least a third of the crowns. So the guy would have needed a full mouth rehab, 14 on the top, like 13 on the bottom. Did all the presentation, all of this stuff, and he comes back like 3 months later for like his perio visit, and he's just mouthful of brand new crowns. And I'm like, so here's.
But the question, are they any
they're
good?
awful.
Because a lot of times they come back and they're terrible.
At this point, we've replaced about a third of them, most of them with a root canal, build up, new crowns. And so it's just always interesting because I'm like, certainly they're not going to throw another country under the bus. There are plenty of countries that do tremendous dental work. There's plenty of areas in this country and those countries that do horrible dental work. And it's just, I'm like, dude, you're going to end up spending 3 times that amount because you spend it the first time plus your travel. Now we're chipping away at them one by one, but we're adding root canals when they would have just been crowns. It's just like, it's just an interesting thing.
You're missing parts. You're missing 2 pieces in that. Because I had a thought about that when my mom needed a dental work. And so one that you're missing is the comfort level with the dentist. So a lot of times they can't really speak the same language, and so they'll go back home simply because they can talk and explain, and it's really hard. It's a thing when they can't really articulate the pain and stuff like that, especially the dental pain. The second part, I think, is when you take into account the cost, you say the ticket and all that, when you adapt, they think opposite. You're going there anyway to see the family. It's not an extra cost, right? It's actually a saving. So you're going there to see the family, and at the same time, you're going to get.
If there's any dental assistants listening,
that's how they
learn multiple languages. And that's for every 4 languages you learn, then you get additional raises, right? And then we'll eliminate.
Yeah.
That's not even a joke. I'm helping to hire for an office here in rural Colorado, and the majority of their patients, like he's like, I need someone who's bilingual. Like it's like we have to.
You didn't tell them extreme ownership. Learn it yourself.
I had some other words for him, but that's not.
Yeah, I was gonna say I'd say half of our assisting staff speak Spanish, and we need them. And a lot of times it's like the front desk folks, only one of them speaks Spanish, and if she's not there, it's like somebody come up front to speak Spanish, because otherwise, you've stopped already. It's a non-starter. But some of these countries are actually being known for medical and dental tourism, and are doing a really nice job. For my patients that are going to go out and do this anyway, what I always tell them is find out where your doc was trained. Because, I've seen some really nice work come back from some countries that generally I don't see nice work coming back from. And then if you start to ask them the question, they're like, oh, they came to Boston and they got trained here.
Yeah.
I
had a lady that was like, these implants, as soon as it's like they were okay for like a month, but it's all burny. It's all burns. And I'm like, what? Let's take a CT scan, 3 implants, 2 in the sinus, 1 in the nasal cavity. And I'm like, well, now you're going to see an ENT because you have infection everywhere. And I don't think you're going to have enough bone to get freaking teeth back, much less like part of your face. But I'm glad you saved a few bucks. That was cool.
But I mean, that's the scary part. Like I have a staff member whose mother went, I think it was Colombia, somewhere in South America, and got a bunch of implants put in and a bunch of crowns. And like the implants are all put in, they have a ton of bone loss around them already, and they haven't been in that long. And the margins on the crowns are awful. And it's like, we need to pull all of these out. But if we pull all these out, there's no bone left. And for her, she's like, oh, everything's fine. Like I can chew and I can eat and life is good. And I'm like, it's going to be catastrophic.
It's really, really unfortunate because,
there's some things
we'll never be able to educate people on.
You don't. They just go. Whatever they need to go, they go. All right, let's switch gears. Ashley's yawning. We gotta start wrapping this up. All right, let's finish up with the Oregon lawmakers. I think it's an interesting case, and then we will. Let me share that Oregon lawmakers bill. Let's see what they got going on. Oregon lawmakers advance bills to increase supply of dental assistants. the way I read the title, it seems like they're going to help out the industry to increase the number of dental assistants in Oregon, if I read this correctly.
Read the article.
Right. Oregon legislators are supporting 2 bills in the House of Representatives that would get rid of written tests for dental assistants, according to April 6th report. House bill, blah, 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 prevents the State Board of Dentistry and Health Authority from requiring dental assistants to pass a written exam in order to receive x-rays. 13 other states already do not require certification in order to operate an x-ray, the report said. House bill gets rid of the written test barrier for other certifications, including polishing dental restorations, placing orthodontic wires, and removing excess cement from crowns. Dr. Jawadi is a dentist in Oregon and the chief sponsor for both of the bills. I want to look him up. What is your take on this? Aaron, you want to start?
So we run a dental assisting school in the state of Maryland. You do have to have 24 hours of classroom time before you can take the Danby test, which is a national test, so you can shoot radiographs. The truth of the matter is that there are a ton of dental assistants in the state of Maryland that are shooting x-rays and that do a fine job. And the truth of the matter is that learning how the radiation is generated in the head of the machine and how it's collimated as it comes out matters not at all, okay? It just doesn't matter. At the same time, so no written test, okay, fine. There should be a test. You know how to do this so you're not radiating people over and over and over again. Same thing with rubber cup polishing, so that you know what you're doing so you're not going to hurt anybody. Placing wires, same thing. So I think there needs to be a test, but the written part doesn't necessarily need to be that. Now, in my state recently, I'm ranting, here we go. In my state recently, they changed the rules for being a dental assistant. So dental assistants no longer need to have CPR training, but they do have to pass a training on unintentional bias. So we don't care if they die. We just don't want you to hurt their feelings. Okay. And I'm just beside myself about this. It's just like, throw the other one on there, fine, but CPR training. And the truth of the matter is the person that's going to keel over and that needs to be rescued is probably the dentist.
You don't have the sex trafficking one that they have?
Okay, I'm done.
That's a new one here. So my opinion
for dentists,
on this
yes.
is that
For
dental
assistants,
schools
no.
don't teach them shit anyway, so I don't even freaking care about a test. It's asinine to see. When you
say dental schools, dental assisting schools, I want to be very specific.
Yes, they don't
dental
teach them anything.
Schools, right?
To Aaron's point, on most of the tests, they still have to know what chemicals to mix to expose the X-rays, and then how to dispose of that.
Yeah,
I mean,
yep.
So it's I'll get on my high horse. Jesus Christ, it's stupid. All of their learning is going to come from the office. It's stupid. It's stupid.
All right, on that, Ashley, what's your take?
Having worked at a dental assistant school for many years, but the reason that it was started was the same thing. They're not going to prove anything by taking a written test, I don't think. Also, like, you're as a dentist, you need them to be taking good radiographs, so you're going to teach them how to do that. And I think that.
What I agree with is that they're lowering the barrier to entry because it's always a money thing, right? And so that you look at the cost of some of these, the cost for somebody who is high school educated and is looking to score a career where they're going to start off at $32,000 probably doesn't have $8 or $9 grand lying around for school. And so, like, if you can lower the barriers for those, all of the education is happening in the office anyway. I think that's good. So I think most other states should get in line with that sort of stuff. But you look at the states that I practice in, a state that has the most freaking rules I've ever experienced in my life. Every single thing is a certification that you have to pay these people this money, those people that money. I can't say which one that is. It's Texas has the most freaking rules of any place I've ever been in.
That's so funny with you coming from New York, and now you're like Texas. That's
nickel and dime the shit out of every word you say, but holy cow, Texas. So there should just be a, this is the like the bar, and everyone can do all of these things. And then certainly if you're going to do things that are getting more into like Colorado, where I think dental assistants are actually dentists now. I'm close. Yeah. Um,
Close.
it's funny to see the people that fight that too. I actually had a good friend who was like, "You want hygienists to be able to get your patients numb?" And I'm like, "Why on earth would you oppose that?" And he's like, "Yeah, it's the next step for like doctors become,
Absolutely.
you know, like there's RNs and there's all of these other things where like the doctors get paid less because they can pay an RN to do things for much cheaper." And so as you add in all of these certifications, this is his point, is that what you're looking at is like kind of cannibalizing the dentist role in the industry. And I can see his argument. But that took decades, and I plan on being retired by then. So yeah.
Sounds like a future problem.
So to go back through some of the things you're talking about. So in the state of Maryland, we're running a dental assisting school. We have them for 13 weeks. We teach them how to do stuff in the office. We have the most hands-on of any school in the state, including the school that's called hands-on dental assisting, okay, where they don't actually put their hands in a mouth at all, and including the group that has a school that runs 18 months, costs $19,000, and they don't put their hands in someone's mouth. It is
19,000?
unreal. It is unreal. It's a crime. It's really a crime. As far as dental hygienists giving injections, so in the state of Maryland, the hygienists could infiltrate, but they couldn't block. And it went like that for a while. Then they finally decided they could block. But then they decided they could block their own patients, but not the doctor's patients. Because as you walk down the hallway in a dental office, as you go to the doctor's side, hygienists become stupid, is what happens. And they lose all the abilities that they've had in their life. You know, it's crazy. It's like, come on, give me a break. You know, if you're going to let them in, if you're going to let them numb, let them numb. If you're not going to, then don't. But don't play this middle of the road game. This is just ridiculous.
But what happens? Who creates this stuff? At least in Maryland. Like, I would assume that it's other doctors that are sitting somewhere in the House or Senate, whatever, or proposing the bills, and they're getting approved. Is it not the case?
I don't know who comes up with these rules or these ideas. I'm sure that their concern is that your hygienist is going to go in there and start numbing up patients. But I've got a buddy in Arizona. He hasn't given an injection in 20 years because he has his hygienist give his injections because he doesn't like sticking needles in patients. And you know, I mean, she still does hygiene and he still does dentistry.
That's like
and,
the dream.
Things are fine.
You walk in and they're like, "Well, that wasn't the nicest needle," and you're like, "Well, let's get to work." But New York was the same way. They can give gingival infiltrations. So like way more painful than an infiltration, like in your gums, right? But you can't move it 4 millimeters up and make it an infiltration. If you're going to let them stick needles into people's mouth, let them go wild. Who cares?
I didn't realize. See, in Maryland, it was never a gingival versus just a regular infiltration. That's even crazier. You can do it into attached gingiva, but no, don't get any of that mucosa because you know
it's like every
might actually not hurt.
Freaking hygienist is like knocking on your door every 8 minutes. Can you get my patient numb? And you're like, when do I get to work? When does that happen?
I'll tell you, it made life so much easier when I didn't have to go over and do injections for scaling root planing.
Brian,
I'm from California. They won't listen to me. They'll hang me.
Texas and try to push it through.
Do they even know you live there? Has it been do they know?
Your driver's license from Texas.
When they
look at his hat, first of all.
That's where I'm from. I say northern Mexico.
Look at his tattoos,
and it throws him for a loop. I don't understand that. I'm like, it's all good.
Hey, come on! Don't shit on my favorite state. I love Texas. We just gotta propose this thing. We gotta propose this thing and see what happens. How far can we go?
Brian, you need a cowboy hat and a big belt buckle, and then run. Uh-oh.
He's got one.
I don't know. I'm afraid. I gotta say.
Probably. So, are we in favor of what Dr. Javadi is doing? in Oregon.
There we go.
That's nice. Keep it up. Keep it up. All right, so that wraps up. That wraps up our episode 1. I hope we covered as much as we can. We're just getting started, so I hope people will not give us a hard time because we're trying to put together these news. The industry is funny. There's not a lot going on to do the news every week or every 2 weeks, so we'll try to do it every month and really dive in and read through and understand what's going on. But I think that was fun. I don't know, what do you guys think?
I love it.
I think we need to be funnier if we want people to come back.
We might as well close it up now. We're done.
I tried my best, but
I'm just teasing. I'm just teasing.
yeah.
To the 4 listeners who've made it this far, hi, Mom.
Yeah, really.
Yeah, thanks, Mom. Thanks, Anahit. Thanks for listening. All right. Thank you, guys. And we're going to do that next month and probably same format.
Oh, yeah.
Okay, yeah, me too. I had a good time.
Good.